Well, welcome back to the Depths of Healthcare. I'm your host, Ben Imes. Thanks for joining us for another episode. Really excited to jump in today with kind of a new foray for us in discovering different types of medicine and different hemispheres of stuff we haven't really explored yet. We've got Dr. William Stanford here. Why don't you introduce yourself, introduce who you are, how you came to be where you're at?
Okay. Well, I'm from Missouri. I went to University of Missouri and studied aerospace engineering, and I worked as an aerospace engineer and flight instructor for about 10 years. Got
Wow.
about close to 30 years old. I got very interested in biomedical science. And so while I was angling for a job flying for the airlines, I also on the side started taking biology, chemistry, and all that kind of stuff. And it just made me
Hmm.
excited about it. Long story short, I was applying for airline jobs at the same time I was applying to medical school. And I got accepted to the physician scientist training program at UCLA. And at that time, it's how old I am, in the post Vietnam War era, it was very difficult to get flying jobs, much more difficult than it is.
Hmm.
So that and actually more than that, I decided to do medicine. So UCLA did my PhD in human physiology and my medical trainings in internal medicine. After that, I went to Cedar Sinai, did hospital medicine for 18 years, had a big medical group there. I was clinical chief of general internal medicine when the next epiphany came.
Boy.
When you're doing hospital medicine, you get a real up close and personal look at how, well, and you're an ER. So I think especially in the ER, you see people that come in with things they should have never developed. And that always kind of bugged me, the lack of emphasis on being proactive and preventive. And around 2017 or so, I started hearing about what was being done with genetics and data analytics and machine learning. This is pre AI, but they were still able to do data analytics where they found patterns in individuals' genetic variants that might predict future disease. And I said, hey, that's where this is all headed. We're going to use science and data to have a data driven approach to healthcare. Uh, I did a hard pivot into that and formed the Beverly Hills Institute for Precision Medicine back in 2018. And I've been doing this for 7 years now.
Tell us more about what you're doing with that business and kind of obviously, so now we know where you've built it from and where the kind of inspiration has come from. What developments have you tried to implement with kind of the research that you're doing, but also kind of the implementation side?
Yeah. So a couple things there. One is I didn't mention, early on, I did training in genetics and precision medicine at Stanford under Michael Snyder and did a bunch of coursework there. And one of the things I learned there was that you really want to do whole genome sequencing because there's a ton of information out there, not just in the so-called coding part of the gene that winds up becoming the protein, but in the regulatory parts of your genome and DNA are just as important. So I set up really a consultative practice where I did whole genome sequencing on all my patients. And I started then integrating in really detailed past medical history, deep dive into the traditional internal medicine part of it. Cause after all, I'm an internist, 150,000 patient encounters in my career. Might as well leverage that. And extended family history, not just mom and dad and what did they die of, mom, dad, brothers, sisters, aunts, uncles, grandparents, not just what they died of, but what chronic conditions, at what age did that come on? And I would manually sift through all this for my patients. So I have a very small practice. It would take me, half a week really to do one patient. And I then would do this big consultative report that says, here's what we know. Here's what the prediction is for future risk of disease. And here's what I recommend using the tools of precision medicine to mitigate those risks. And I would deliver that report to primary care providers and their patients, and they loved it, you know. And this is another weird little story, but worth telling. So I went to the University of Missouri,
Yeah.
and so
Go Tigers.
back in 2021, oh, yeah, 2020, they reached out to me, of course, on Zoom, what with COVID and all, looking to raise money for this Precision Medicine Institute. They must have Googled Mizzou alums and precision medicine, and that's how. But interestingly, the check they were looking for was about 5 times my pay. So that didn't work out. But what did work out was getting to know some of the people on that committee. So one of them, they invited me back for the grand opening. I met a couple of those guys, and one of them wanted to go through my process. I did. Turns out he loved it. His primary loved it. And he said, I can make a software platform that automates this for you. And that was the birth of Biography Health. So now we have this online platform that aggregates all this personalized medicine and precision medicine information for analysis. And of course, being a platform and being a software product, so to speak, I think we're able to leverage AI. And so now, in addition, now the beauty is I don't have to mess with any of the whole genome sequencing. I have Biography Health do that. They aggregate all the reports that come out of that. They gather all the healthcare data, past medical history, family history, et cetera, from questionnaires of the patient, and they scrape the internet for all that,
Right.
aggregate that into a big prompt, and off we go. And I'm able to edit that prompt and ask different
Yeah.
questions, take the output, run it through Open Evidence, which is a very highly trusted medical AI. So now instead of half a week, I can do a patient in half an hour.
Wow. I mean, that's massive. I mean, you're actually utilizing AI for what it's supposed to be used for, consolidating data,
Right. Yeah. I
right?
mean, and clearly, even at this, I mean, we all know we see the AI getting better every day, though it's still definitely requires a physician or a licensed practitioner to review it, make sure that you have to look up the evidence behind those suggestions, et cetera. What I find is that it helps structure your thinking and does occasionally come up with ideas that I don't naturally come up with on my own. So you wind up learning a lot too. And you also finding out that there's a lot of weird stuff out there on the internet. That's why you're going to want to vet everything back through trusted sources like better,
Yeah.
like the Mayo Clinic, New England Journal, etc.
Yeah, you're like, where did you actually get this information? Prove to me your source.
Yeah, how come I've never heard of this?
Yeah,
How
exactly. It
many
like goes
schools
counterintuitive
like
to our medical
BS
training.
with someone trying to sell something?
Right. Right. Oh, that's really cool how one creation has led into kind of, I mean, are these companies kind of symbiotic at this point that you've built?
Yeah. Sure. Yeah. I would say without Biography Health, uh, I'd be pretty worn out by now. And,
Yeah.
you know, at this point, I used to be their biggest customer, but I think I'm about not to be their biggest customer. I mean, just because I don't have the volume. So this Biography Health platform is being adopted by different practices. So that's the way for you as a medical practitioner or any practitioner to adopt the tools of personalized precision medicine right into your practice. You
Right.
have to
And are you
give Biography Health the patient name and email, and they take care of the rest. And you'll get all this information aggregated onto the platform. You push a button, 3 seconds later, literally 2.5, 3 seconds later, it rates a full consultation for your review. You
and
can edit the prompt uh, and get different information and start making queries. It's a very powerful tool.
it seems like it. It seems like it's developed into something pretty impressive. Who do you see, like who is utilizing it the most out of the clientele that you have?
Yeah. Practices that are branded toward wellness and longevity.
Okay. Okay.
So
So a lot more private practices rather than like big healthcare systems.
yeah, having come from a big healthcare system, I know better than to try to delve into that where, you have a committee that meets for 6 months to decide what the committee should look like to evaluate and then that committee meets for another 6 months to figure out what should be included in the evaluation, that whole thing.
Oh, I'm with you. You're preaching to the choir. Man, so I mean, is it pretty well are you finding good traction in these past few years with the different advancements and kind of the more interest in longevity medicine, functional medicine improvements? Have you seen a lot of traction in that hemisphere?
Yeah, I don't have to tell you that that's where this is all headed. People right now are very aware that they can do things to affect their healthcare trajectory, thereby their wellness, thereby their longevity. And it's a kind of a hockey stick kind of thing, to use that phrase. So these wellness and longevity clinics are popping up all over the place, and it's great to see that. And it's great to see that people appreciate how whole genome sequencing and understanding every single point of genetic variation in an individual can help leverage those methods that we use in generalized traditional medicine.
And so, I mean, it's really incredible the stuff that we're able to predict now or continuing to learn to be able to predict what I mean, you're still practicing and seeing patients, right? Like you're still front and center seeing them. I mean, obviously this helps your practice just to be able to develop plans of proactive care rather than reactive care, which is what I find is how we were mostly trained is reactive care to certain medical diseases, right?
The sick care system all set up around insurance reimbursement, which is set up around episodes of illness.
Right.
It's a system that probably was very functional at some point in time. I'm sure there's good reasons why it was set up like that, but right now it couldn't be more dysfunctional and out of step with what's possible.
Yeah. I mean, what are your dreams then for the next, I would say 5 to 10 of I mean, it's hard to break and transition the system, but what do you think your influence can be in that hemisphere?
Well, I'm going to answer the first part of your question and make your podcast more interesting and controversial.
Oh boy.
So I'm predicting as at least a semi collapse of the commercial insurance industry as we know it. Now, I realize they're powerful stakeholders and they're not going to slip easily beneath the waves, but I see this grassroots movement where people realize that they can pay cash for something and get the exact same thing for the same price as the copay if it goes through insurance. Pretty soon, you see that with like Good RX, Simon Med Imaging, whole genome sequencing. If you pay cash for it, it could be $400. If you run it through, if you could even run it through insurance, it would be whatever the copay is on $4,000 because that's just how people bill insurance. So I think that people are going to increasingly seek out practices like mine, the so-called direct patient care, where they just pay me cash. We leave insurance out of it. There's something that I think you need, I'll order it. If insurance pays for it and the copay is less than what you could pay cash, and a lot of times it's almost the same thing, we'll do whichever one makes sense. And if insurance doesn't want to cover an MRI because the radiology company is charging them $2,000 for it, but you can get it for $350, I'm just going to order it. And the patient will pay $350. So I think that that's going to put a lot of pressure on the commercial insurance industry. I don't know if they're going to withstand it. So that's my controversial piece for the day, that commercial insurance as we know it will collapse to a certain degree. There'll be likely, this is again my grand prediction, a single payer that covers the catastrophic kind of all of Medicare. And I think that's where this is going.
Yeah. Yeah. I mean, thanks for that insight. I mean, I just got this might be too much information, but I just got an email today about my ER group, and they're like, "Hey, your premiums are going up by 10%." Guess what? Our pay did not go up by.
And I'm hearing in all this discussion, what with the government shutdown and all, and they're negotiating insurance, and the number I hear batted around, it was like, I think 10% is good. I'm hearing like 15 to 25% that
Wow.
premiums are expected to go up in the next year or two. So, and it's just going to get worse from there because of the way that the insurance industry is set up around episodes of illness. Again, if they would pivot out of that, that would may save them, and they may well do it. But the stakeholders, this is a $4 trillion a year industry in the
Yep.
U.S.
Yep.
People are not going to part with that revenue stream very gently.
They will not go quiet into that cold night.
Yeah, that's your Dylan. Is that Dylan Thomas? Yeah, I think whatever. Yeah.
Yeah. Yeah. Well, thanks for that prediction. Where do you see your niche kind of growing and your specific role and your specific companies kind of growing in the next 5 to 10? Or at least what's your dream? Obviously, you build companies, you're a dreamer.
Yeah. I didn't realize I was a serial entrepreneur. So I read this book called The VC Mindset, and I go, wait a minute. Yeah. What I have a pretty modest, dream, so to speak. What I would like to see is for our society to move toward a proactive, preventive approach to healthcare, data driven, leveraging what's out there. I, in whatever role I can play in that. Of course, I speak, I do a lot of these podcasts, I edit a book by fair implementation of personalized precision medicine. I did, I should say. And I want to make that kind of contribution toward leading the field. I mean, interestingly, when I started in hospital medicine, there was no such term, hospital medicine. There was no such hospitalist. People go, what are you doing? I'm like, well, community doctors admit their patients to me. I get them all buffed up and feeling better, and I discharge them back. And I said, no, doctors were never going to go for that. So that was done. But the interesting thing is you find that, best practices that when I was at Cedars, I was the only hospital. So in 2002, I was
Wow.
in Cedars that did hospital medicine outside of the teaching service, so to speak. And so you learn that what you do ultimately gets adopted into best practices as the field starts to take shape. And so I'm very mindful of that with personal precision medicine. And that's why my practice and Biography Health leans into some core values like security and privacy of the healthcare data, ownership and control of the data by the patient, transparency in how we're doing what we're doing, everything evidence based. You can do all this wellness and longevity and just use stuff that there's great evidence for without having to drift into the fringe. Of course, those fringes as human safety and efficacy and from data comes up for them in studies, they'll get added into that pot. There's plenty to do even without having to venture into interventions that have just been tried in laboratory animals. And there's not good human studies for efficacy and safety.
Right. So, I mean, probably you're pulling most of your data and research off of the big core, like chronic disease prevention, disease processes. So the blood pressures, the diabetics, that kind of stuff.
Pete
Correct.
Latia calls them the four horsemen in Outlive. I have six horsemen. I threw in a couple.
What are
But
yours?
those usual four is cardiovascular, neurodegenerative, cancer, metabolic. And I add in autoimmune diseases and inflammatory diseases and musculoskeletal, just because most of my patients are young and healthy and active, and they wind up with these musculoskeletal things and want to know what to do with it.
Yeah. what's an example that you've seen?
Say again?
What's a most recent example that you've seen?
In which category?
I would say the young, I mean, young healthy people that are trying to be proactive in their health. Like, what are some of the musculoskeletal disorders? Is it just the classic like tendonitis kind of
Well,
stuff?
classic, well, more like osteoporosis, osteoarthritis, and then
Hmm.
sarcopenia, those kinds of things.
Okay.
And then
Yeah.
joint injuries and recovery from joint injuries. Yeah.
Yeah, which is a very yeah, that's a big side of the business and a big side of healthcare for the young population at least.
Yeah. And here's the thing, and this is again Peter Attia speaking, but I endorse this 1,000%. All the you're a young guy. You mind me asking your age?
34.
Okay, 34. You realize that you have the start of the beginnings of heart disease and atherosclerosis and all that. Do you realize that starts in the 20s?
Yeah,
And so these chronic diseases have huge runways. And so, and I'm gonna get a little crazier on you. You ready?
do
I
it.
think that 30, 40, 50. So you're 34. 50 years from now, can you imagine 50 years from now, you're going to be 84? What do you think healthcare is going to look like then? What do you think your health is going to be like then? Is it going to be like me when I'm in 20 years, when I'm 85? No,
Man. No, it's gonna be completely
it's going to
different.
be completely different because you're going to have heard what I said today, and you're going to go off and go, there's all kinds of things that I can do right now to make sure that when I'm 85, not only am I not dying of a heart attack, but I basically don't have any atherosclerosis and I don't have osteoporosis or osteopenia. I learned that when I'm in my 40s, 50s, 60s, you want to build muscle mass because that's a great predictor of longevity, prevention of injury, and all that.
Yeah, we'll still be deadlifting at 84.
Yeah. Oh, yeah. No, you will. You will. And you'll probably, best way to live a long, long life is not to die prematurely as something preventable. And right now, everything's preventable. And should a 30-year-old care about these diseases of the elderly? Yeah, because they're starting now. So I have a 35-year-old daughter, you know, I have her drinking the Kool-Aid, so to speak. So she is, comports her life and wellness and diet and exercise and sleep and stress and
Yeah.
alcohol consumption and all that kind of thing, as if she's likely to go well past 85.
Yeah, and I think I mean, okay, so don't yell at me if I'm saying something that's sacrilegious to your field, but for me, I don't see this as what the term is biohacking. Like, I know you've probably heard that term 1,000 times because it kind of relates to your field and to your, kind of direction. But I don't see this as really biohacking. I just see it as being proactive care. You're kind of just saying, hey, I know these things can kind of build on themselves. Like it's a foundation that's being laid now when you're in your 20s and 30s. And there's a lot of like predictors that can be for just from your family history that might be lurking that you're just not aware of, right?
Oh, yeah. So I'm not sure I know exactly what the term biohacking is. Always, when I think of biohackers, I think of my patients that someone else, Florence commentates, you can't give this term to me, self quantifiers, so they want to, measure everything and I don't know who said it, but you can't really affect change unless you can measure it. So yeah, so I'll say that depending on your definition of biohacking, I think of it as just aggregation of information about what your body's doing, and I think that's a good thing.
Yeah. I mean, it's pretty impressive to see how this whole industry continues to grow on all fronts. It's not very cohesive right now, I would say, just in my opinion, but there's a lot of good kind of fragmented ideas coming around. Like I've even heard of ultrasound reads of breast tissue that can identify before stage 1 cancerous growths. I mean, things like evaluation of atherosclerotic disease with AI overreads of, coronary CTAs. I mean, all the stuff is coming out, but it's all very much like, hey, I do this portion, I do this portion, I do this portion.
Together for you a little bit. So
Please.
this is what they should look like, and this is how what my vision. This is what my vision of it. That of course, the way my practice is set up and manifests in biography health. So you've heard the term personalized medicine and precision medicine, right? And talking to everybody, I guess, and people think they're more or less the same thing. They're not the same thing. So personalized medicine is individualizing what's unique about the patient. So your points of genetic variation, your specific family history, your specific past medical history. And so within that personalization, you can do data analytics on that information to predict risk of things. And not every person, in fact, no two people, not even identical twins, have the same risk. And so what you want to do is look at those points of increased risk, especially when they're like 2 times the population average, and use those tools of precision medicine. Precision medicine, so to use a military analogy, there's finding the target, that's personalization, and a precision munition, like say the right ammo for the right target at the right time kind of things. Precision medicine is targeting those areas of risk in the individual. And does everybody need everything? And the answer is absolutely not. People would not want to take every supplement in the world. People would not
Please, please no.
do every test in the world. So it's a little bit like Las Vegas, and when you play blackjack and these people that count cards, what they're trying to do is figure out when the dealer's holding a bunch of face cards. So if they have a 5 up, they're going to bust, right? And so that's where you put your money. And so personalized precision medicine, it's much the same.
Yeah. Yeah, you want to find out what the highest. I mean, it's like if I knew that I had severe atherosclerosis, like I'd want to address that before, the right knee arthritis or like osteoarthritis that I'm developing. Right.
Well, certainly. And if you are developing osteoarthritis and you can deal with both of those, but there's going to be things like Parkinson's disease, for example, or some neurodegenerative disease. You're not at any particular risk. There's certain you don't have family history. There's certain common sense things you're going to already be doing for other things like those main lifestyle. The interesting thing is lifestyle interventions alone, if you could get those 8 or 9 things right, what, and this is not me just talking out my rear end, as they say, would prevent 40 to 50% of these chronic diseases. So
Yeah.
there's definitely a place you can start for everything. But let me give you, say, a real life example. So here's an interesting thing. And this did just come up in the last couple of weeks. In fact, I learned it on my own podcast interviewing a geneticist.
Yeah.
So I have a couple of patients that are what we call polygenic risk scores, which is looking at basically all your points of genetic variation. For them, their risk is like 2.5 times the population average. They're well into the 90th plus percentile. So someone pointed out, well, this Dr. Jeff Gulcher with Galatea pointed out to me on the podcast that there's a New England Journal of Medicine article, a study done in Europe that showed, and I'm just going to get to the bottom line, that of those people between 90th and 100th percentile by polygenic risk score in terms of their risk, before you even get to family history, PSAs, or anything, 40% of them in this study that were age 55 or above already had clinically significant prostate cancer. Let that sink in. So if you can identify these people that are at very high risk, just like we used to identify those monogenic risks, like Lynch syndrome, like BRCA and breast cancer and ovarian cancer, et cetera. If you can identify them, you're going to do a different precision approach to making sure they don't die of that disease. That's really how this is all going to work. And as we go forward, these, good science hopefully is still going to be getting done. And we're going to learn, you know, the people at risk, what should we do? What's the probability? And as these new tools of precision medicine, we apply those. So it's
Yeah.
it's going to be, it gets more interesting every day, every week, every month. And that is just accelerating that corpus of knowledge, so to speak, around medicine is just increasing exponentially. Thank goodness AI is going to be around to help us sort through it.
Yeah, because I mean, even like you said, the time that's being saved already that you're seeing in biography is, I mean, just that makes you able to treat more patients without losing your mind and burning out.
And, the emergence of these digital platforms is huge. And so I'm sure you've heard of these platforms that will aggregate like wearable technology and display it and track it. And again, to really improve something, you have to be able to measure it and track it.
Yeah, and I just love that we can now condense that data. Like, let's give these LLMs more data to kind of be able to kind of learn from, and then practice a million times over, right? Because then it becomes more and more efficient. I use in my clinical practice, like the only AI that we're using is DAX Copilot, which is partnered with Epic, which is the big EHR. And to be honest, I'm not very impressed. It's not learning very quickly from all the patient encounters that I'm using to do the interface between me and patient. And so, but it has to learn. So I have to continue to be able to give it the more information to learn from, right? Because over time, hopefully it continues to be optimized.
Yeah, no, you're on the right tracks. You don't have to wait for perfect to get started.
Yeah.
Seems pretty clear that there's a ton of entrants. I just heard this discussed the other day. 10, 15, 20 of them between you and I, we could probably name AIs that are, you know, targeting exactly what we're talking about in healthcare. Whether it emerges that one's at the, like if it's one's up like Google, where everyone there's a Google search and then there's really nothing else. There may wind up being an AI like that, but I have a feeling there's going to be more like 1 through 7. It's going to kind of like I see it more like the airlines will consolidate into the top five or a handful.
Well, I mean, just like the tech, hemisphere. It's the top, the big three or the big five or whatever it is. Just being able to consolidate in front of everything. Yeah, man. Any words of wisdom as we kind of close out and kind of tie things off? Anything that you'd like my listeners to be very aware of, kind of in what you're doing and how they can reach out to you as well? That's like a 4-part questionnaire close off. So good luck.
All right. Well, the first thing is my email is Dr. Stanford, DrStanford at B as in boy, H hotel, I India, P Papa M Mike.com, BHIPM.com. The one thing I would want everyone to know is that science is advancing rapidly, and no matter what age you are, to know what your risk is of future disease that could wind up debilitating, affecting your health span, you can move that needle right now. And it's not that much money. And the other thing is almost literally everything is actionable. A lot of people say, oh, I wouldn't want to know what my risks are because, well, what are you going to do? Well, everything is actionable. Trust me. 50% of Alzheimer's disease is thought to be preventable through lifestyle interventions. You're going to see there are studies out that not only can you prevent cognitive decline, even in those cases where you have family or personal genetic risk for Alzheimer's disease. But you're going to see studies that come out that show that that's not only slowed down, but even reversed. You're also going to see heart disease get reversed.
Yeah.
Yeah. Yeah. And well, you're not going to, that's already been done. So in terms of getting regression of atherosclerosis with aggressive treatment. And What else? Start early. You don't have to do everything at once. You don't have to become an Olympic athlete, but learn what those things you can do. There's some extremely low hanging fruit out there, tight control of your blood pressure, something as simple as eliminating added sugar from your diet. You need to,
Hmm.
for basically all those six horsemen, you need to protect your sleep like a dog protects a bone. And you want to get a sleep tracker, understand what your sleep is. I'll plug a guy that there's a great company out there called Empower Sleep that will, you've heard of them?
I've heard of them.
Yeah, they have a great device, and I pimped the guy all the questions, so I could understand the tech behind it or if there was some kind of BS going on. It's legit, you know, trained, blah, blah, blah. And they also have sleep coaches, so they can help sift through this sleep data, identify what your problems are likely to be, and make solutions. So all those lifestyle things, start with that. Start with find someone like myself that can do whole genome sequencing and some data analytics and avail yourself. It's not, I think a lot of people think that, because of what's not Dennis Johnson, who's Brian Johnson.
Brian, I was gonna quote him, but you brought him up first.
You don't have to be a gazillionaire to do 99% of what that guy is ever going to accomplish. I mean, he literally does everything, and I've seen the menu of what he does, and there's a huge chunk of it that there's just zero evidence for.
I know.
I'm not saying he's gullible, but I'm saying he's willing to do anything, I guess. But there's plenty of stuff that's within your budget, that's within your means, that is going to really move that needle. And the sooner you start, that's better off you're going to be. And as they say, you can just start really small, those incremental changes, those atomic habits, so those small incremental changes.
Are you quoting that book now? Are you quoting another book? I think I
Is
have it
that
sitting
Ryan
over there.
Holiday?
Yeah, Atomic Habits.
Yeah, I like that. I mean, I read that book like 10 years ago and he obviously nailed it. And yeah, I reference that in what we're doing because I think it's an obstacle for a lot of people to starting an exercise program, to getting their sleep right.
Yeah,
It's got to
yeah,
be, if I can't do it all and I can't do it perfectly, then I'm not going to do it at all. When
right.
really there's huge benefits to these small incremental changes will really move the needle.
Where can people kind of either request, Biography Health's kind of services, or how can they get that connected with their provider? Are there opportunities for my listeners to kind of find a way to do that?
Yeah, biographyhealth.com.
Hmm.
And on that website, there's links and chatbots and whatnot. You just follow what's on the webpage, or you can also reach out to me at that email I gave.
Well, you're too accessible.
I love being accessible. So I have a small practice, and I'm easily accessed. All my patients have my cell. They love having a doctor that they call, and doctor just picks up the phone.
Oh, that's
And
awesome.
show you, I don't even have much in the way of staff.
You're a rare breed, Dr. Stanford. Patient facing in the old sense of the way.
Yeah, I'm very fortunate to be able to practice in this way,
Very much so. I really appreciate your time today.
and certainly willing to help anyone get connected to Biography Health. Or I'm happy to talk to your doctor and see if that's something that they would want to do. For the providers, it literally there's no training required, so it takes about 30 seconds or a minute to create an account on there, and another 30 seconds or a minute to refer your first patient. So it's pretty cool. Pretty simple.
Wow. Really, really simple, really cool, low barrier to entry. Let's start getting it adopted. All right. Well, thanks for joining us today. Really appreciate your time. Can't wait to spread the message.
Well, I appreciate you, Ben. That was really fun.
Yeah, absolutely. You take it easy.
Thank you. You too.